Well, we can speak now to Dr. Oliver Johnson, the Programme Director for the King's Sierra Leone Partnership. He returned from Freetown, Sierra Leone just this morning. Oliver, thank you very much indeed for being with us. You've returned for a short period.
Yep.
When you came into the country, what kind of screening did you go through this morning?
Well, the first thing to say is the screening started before I came into the country. Even as I left Freetown Airport, there was a detailed history taken. My temperature was checked 3 times by a health worker. And then arriving at Heathrow, what we had was another temperature check and a detailed history with a nurse there who took a history of everyone who was coming out of West Africa.
Which is interesting because exit screening is something that is being talked about a lot in Europe today.
And there's been a lot of international supervision of airports in West Africa to make sure they're up to scratch. So I think what we can say is it's clearly a robust intervention there to make sure Britain remains safe. But what we've got to remember as well is that to stay safe, it's got to be about tackling the response at the heart of the outbreak in West Africa, and we can't just put up walls. What we've got to do is reduce transmission and stop the outbreak right back in Sierra Leone and Liberia, Guinea, where the cases are being transmitted from.
Just in terms of the screening, you got to Heathrow, there was more screening for you today.
Yep.
And what kind of monitoring do you go through now?
So it's different for every patient, and so what they'll, or every passenger rather. So for every passenger, they'll work out their level of risk, and they'll decide, whether they need to be followed up or whether or not, just to give them good health information and good, maybe regular phone calls to take temperatures, this sort of thing. So it's a robust practice. It's one we're seeing across the world at the moment. And I think it's very appropriate.
And you're confident that practice and the protocols that have been put in place are the right ones?
Yeah, I defer to the specialists at Public Health England, who are the real experts on this. What I really know is Sierra Leone. But for me, I was impressed. And
but as a medical expert, and with what you know about how Ebola can be contracted, you're confident in that?
Yeah, it seemed very appropriate to me.
In terms of the experiences that you've had in Sierra Leone, you've been out there for 2 years now. So you were out there at the point at which the Ebola crisis took hold. Yeah. What has it been like for you?
I think when we first heard that there was Ebola in the region, what we expected was we'd see maybe a dozen cases or a couple of dozen where the King's team is based in Connaught Hospital in downtown Freetown. We set up a small unit. What we've actually experienced is far beyond what any of us could have imagined. Hundreds of suspected cases.
To deal with it?
So I think we, from day one, we were starting to get trained. MSF was there, the World Health Organization, and King's brought in infectious diseases specialists from the UK who'd managed Ebola before. So we were really doing our best to get ahead of the game. But the country as a whole, its health system wasn't prepared for what has just been a tsunami of new patients. And what we're seeing at the moment is an exponential increase. That means that every day there are more new cases than there were the day before. So there's a desperate effort at the moment, of which King's is a central part, to try and set up more beds so we can isolate patients from the community and stop people transmitting it to their homes. But at the moment, we're still playing catch-up, and I know the British government's, the whole effort of the British Army, the Foreign Office, DFID and other organisations is to get that bed capacity up so that we can turn this outbreak around and begin to reduce the number of cases.
What are conditions like now working in there, and how have they changed over the past few months as the world has woken up to the threat of Ebola?
I think the world did wake up late. At one point, King's was one of the only organisations alongside Médecins Sans Frontières, WHO, who were there. What we're now seeing is a major response, a lot of funding, and a lot of organisations now flying in more medical experts, more supplies. The challenge really is to find organisations willing to go on the front line. A lot of organisations are up for doing training and other things, but to really have the clinical specialists who will go shoulder to shoulder with Sierra Leonean colleagues who are fighting this on the front line is the challenge. And what we need now is people like that and people from across the NHS to come forwards so that we can get hospitals ready, hospitals opened, and begin to take the challenge back to this disease and be on the front foot again.
And there are many like you who will say, this is my job, this is my duty, this is what I want to do, but in the knowledge that you are putting yourself at risk.
I've been overwhelmed by the quality and the sort of self-sacrifice and confidence of the people like my team. I've got about 10 doctors, nurses, pharmacists from the NHS who have taken time out to come as volunteers to really, step up. And they are, you can minimise the risk, but no organisation can ever eliminate it. And so absolutely people who are out there, they're aware of the risks, but they're putting themselves in danger, not only because they want to make sure that we protect our colleagues in Sierra Leone and the patients there, but also to keep Britain safe.
Seeing what you see and the suffering that you see day after day after day on the scale that we're seeing with Ebola, what impact does that have?
I think for all of us, it's a horror what we're seeing out there. It's a modern day plague. For the whole city of Freetown, which I know, the city's completely changed. It's a quiet city now, and there's a tension that everyone feels. Everyone's afraid. And for doctors and nurses, like people on my team, we've had colleagues be medevaced, flown out, other colleagues, Sierra Leonean colleagues who have died, and we've been the ones to treat them. Every day now we're seeing whole families, young children, aunties, uncles, grandparents, all come in. Many of them die, and sometimes just one or two family members left, and desperate pleas from communities who say, look, I've got a sick relative at home. Can't we bring them into hospital? But there simply aren't enough beds, leading to really horrible choices. And so it's a challenging, very challenging time.
And we're seeing situations now where children have been orphaned, and they're also being distanced from their own communities because of the fear that they might have contracted or be carrying the virus.
What we try to do is to really demonstrate that the confidence that survivors should feel by, when they leave, hugging them, helping them back into their communities, try and reduce the stigma. But the stigma is everywhere. The stigma is also felt by our health workers in the hospital, Sierra Leonean colleagues. Got two fantastic young nurses there who have been told by their uncle where they live, you can't come home if you continue to work in that unit. And they've said, well, we're committed to this. We're doing this for our people and our country. So they now live in the hospital with us because they can't go home. And many of the British health workers, when they come home, face stigma. You can't.
Have you felt that coming home?
I have had. I've got a family and friends who have welcomed me back, but I know others have felt it hard. Who've been told you can't come to this event, or you're not welcome here, or we're afraid of touching you. And I think that there is a real sense now of fear in the UK as well about these sorts of things. And from the British government, I think the decision to stop the direct flights by Gambia Bird from London to Freetown is a devastating blow to the response. And it's really disappointing that the government has made that decision. We had urgent medical supplies and urgent new volunteers who were due for those flights. But I think there's a lot of fear now in the government, and so sometimes overreactions.
OK, Dr. Oliver Johnson, thanks very much indeed for talking to us, and good luck when you return to Sierra Leone.
Thank you.